cardiologist specializing in women's cardiology, as one of our guest speakers today. Women's heart health is a critical topic of importance, and in fact, one of Zedek's most recent grant applications from USAID ASHA is to help the hospital to purchase 44 wearable wireless telemetry monitors to bring superior quality healthcare to patients who come to Zedek for specialized cardiac care from across the region. Dr. Nieca Goldberg serves as the medical director of the Joan H. Tisch Center for Women's Health at the NYU Langone Medical Center, clinical associate professor of medicine at the NYU School of Medicine, co-medical director of the 92nd Street Wise Cardio Rehab Program, and is a national spokesperson for the American Heart Association. Dr. Goldberg's focus is cardiovascular disease in women, exercise, imaging, and exercise. She has published multiple books on women's health and is often asked by the media for her expert interpretation of current studies and medical news. For the past 11 years, Dr. Goldberg has hosted a weekly radio show on Sirius XM for women's health called Beyond the Heart. And she started the American Heart Association's Go Red for Women campaign. It is our pleasure to welcome Dr. Goldberg to speak about heart disease, the #1 killer of women. Thank you.
Thank you so much for that lovely introduction. I want to commend all of you for the magnificent work you do to help women's and men's hearts at Shaare Zedek Hospital, and the addition of those telemetry monitors will help you pick up more heart arrhythmias and ultimately save people's lives. So in our country, cardiovascular diseases are the leading killer of men and women. In fact, 1 in 3 people has heart disease, and every 38 seconds, someone is having a heart attack. For many years, heart disease was the leading killer of women, where more women died of heart disease compared to men. But in the last few years, with awareness campaigns such as the Go Red for Women campaign, we've seen an improvement. Yet, we're not ready to rest on our laurels because there seems to be an uptick in heart attacks in younger women, women under the age of 50. And so we're going to explain what puts all women at risk for heart disease, no matter how old they are. The majority of heart diseases, or what types of heart disease affects men and women, young and old, is that 44% of it is due to coronary artery disease, narrowed arteries that go to the heart muscle. The other largest portion is stroke risk, and the remainder is heart valve disease, high blood pressure, which is very common. Over 46% of people in our country have high blood pressure, and only 1 in 5 people who have blood pressure on medicine are controlled. So when it comes to women, we know that 2/3 of women having their first heart attack die without any warning signs at all. But when studies were done on the medical histories of those women, they found that the majority of them had risk factors. 90% of them had risk factors that we could have treated, like getting someone to quit smoking, treating high blood pressure, lowering someone's cholesterol, picking up the fact that they have diabetes and screening them better for other risk factors. So in fact, 80% of heart disease is preventable. So right around the time I was in medical school and finishing up, and my mother was able to say my daughter, the doctor, we learned about the typical heart attack. And one of the problems is in the medical community, for many years we thought of heart disease as a man's disease. And this is a picture that I saw in my second year of medical school of the typical patient having a heart attack. It was a middle-aged businessman on a cold winter's night clutching his chest. But over the last several years, we've learned that women don't have to have this Hollywood heart attack where someone's clutching the chest. Instead, the symptoms can be interpreted as more subtle. Sudden onset of shortness of breath, where you feel as though you've run a marathon but not made a move. It's a tightness or squeezing or pressure in the chest that men and women can feel, but sometimes women express that they have symptoms similar but in the upper back, feel exhausted, experience nausea, vomiting, dizziness, rapid pulse rate causing them to faint, or sometimes that the pain is not in the center of the chest, it can be in the right or the left, but if it's in the lower chest, we find that oftentimes the women mistake it for a stomach ailment and are quick to take an antacid instead of calling 911. So it's important for us to learn all the signs of a heart attack because you don't know when it could happen to you or someone you love. So what puts us at risk for heart disease? Well, it's a family history, and you know you can't change your genes. So if your father was less than 50 and your mom less than 65 when they had their first heart attack, it puts you at about a 35% higher risk. As we get older, it becomes more common, and cigarette smoking triples a woman's risk for having a heart attack. In fact, smoking not only increases risk for heart attack, it also brings on menopause 3 years earlier, not to mention the wrinkles it can create around your mouth. Diabetes is a risk marker in both men and women, and we find that even pre-diabetes, when it's not, you have just a mild elevation of glucose, it can triple your risk for having heart attack and stroke. High blood pressure is something that's very easy to pick up. And we think of it not only as a risk factor for heart disease, but it is a disease itself, because high blood pressure can thicken the heart muscle, and it is the leading cause of heart failure in our country. So the reason why it's important to take steps to lower your blood pressure is not only to prevent a heart attack or stroke, but it's also to reduce your risk for heart failure. And particularly when it comes to weight, it's not necessarily being just overweight, but in women, particularly having the weight around the middle, as I see people in the audience know that already, that it's more likely to increase your risk for heart disease and type 2 diabetes. Physical inactivity increases your risk by 50%. And something like taking a moderate-paced walk, which is the fastest way to get around in New York City these days, that you can actually lower your risk by 50%. There is another condition known as cardiometabolic syndrome, which is a cluster of risk factors, having belly fat, high blood pressure, elevated glucose, and elevated triglycerides. That condition where you have that cluster of risk factors causes a twofold increased risk in heart attack. And we learned that some things that we prescribe to young women can actually increase the cardiometabolic syndrome. So prescription of certain oral contraceptives can actually raise blood pressure and triglyceride levels. So it's really important for us to screen young women before they're even prescribed oral contraceptives, and certainly to take their blood pressure. Very frequently, I'm asked about inflammation and the heart. So we know that inflammatory conditions such as rheumatoid arthritis, lupus, psoriatic arthritis, the women who have those conditions are at higher risk for vascular disease, and the inflammation is a stimulus to the buildup of plaque or the cholesterol in the walls of the arteries. One way we can measure the inflammatory risk is by drawing a blood test called the high sensitivity C-reactive protein, or cardio-CRP. It's best used in men over 50 and women over 60 because we found out that once the number is 2 or more, lowering that number with the use of statins or cholesterol-lowering therapy actually lowers risk for heart disease. Let's take a look at what can affect conditions that happen in younger women, such as pregnancy-related conditions like preeclampsia, high blood pressure during pregnancy, and diabetes of pregnancy. Those factors can lead to increased risk for type 2 diabetes and high blood pressure, stroke, and heart attack in midlife. Although we don't know the exact mechanism of why that happens, the blood pressure goes up during pregnancy and it can actually improve, but later, and that's true of the glucose, but later on it can reemerge. So it's important for women who have had those conditions to be followed regularly, not only by their gynecologist, but their primary care physician, or consider seeing a cardiologist. I've mentioned the issues of lupus and rheumatoid arthritis, but also another important women's health issue is breast cancer. And it's important for us to make available all those treatments for breast cancer, be it radiation, chemotherapy, surgery, whatever is needed. But I just want to make sure that as women are taking care of their breast health, they also need to take care of their heart health, because we found that certain chemotherapies can weaken the heart muscle, and radiation therapy can actually accelerate the buildup of cholesterol in the arteries and buildup of calcium in the heart valves. So when someone is being treated or getting ready for the treatment, it's important to ask the oncologist about having your heart checked out before and periodically during the treatment. Very frequently, we have to lower cholesterol with medication. Although diet and exercise are important foundations to heart health, and we'll explore in a little bit what's the best way to use diet and exercise to improve our heart health, that we have to understand that only 15% of the cholesterol that we measure in the blood is due to our lifestyle. The rest of it is genetically predetermined, and is really based on what you were given by your family members. So we prescribe cholesterol medicine for people who have heart or vascular disease, no matter what the cholesterol level is. And that's because we know that we can reduce risk for second heart attacks and second strokes by doing that. However, if someone has a bad or LDL cholesterol of 190 or more, they are also a candidate for cholesterol medication, as well as people who have diabetes without heart disease or vascular disease, because diabetes is just such a strong risk factor for heart attack and stroke. And if you're in the doctor's office and not sure if you should be on a cholesterol medicine or not, you can ask your doctor to calculate your risk, because doctors have an app to do this, and most of the electronic health records have the calculator already in the medical record system. And this is a calculator that assesses your cholesterol, your blood pressure, your age, and if the risk that is greater than 7.5%, your doctor may be discussing taking cholesterol medicine. So you feel you're absolutely healthy, and the question is, should healthy men and women over the age of 60, men over 50, should healthy men and women take cholesterol medicine? And in the CRP study, where we had men and women of the appropriate ages, men over 50, women over 60, taking cholesterol medicine if their CRP was elevated 2 or more, we saw a 44% reduction in heart disease risk. So it's important when you go to the doctor and someone's talking to you about taking any medicine, whether it's blood pressure medicine, cholesterol medicine, or aspirin, that you make a shared decision with your doctor. That you ask the doctor, why are you recommending this, and what is my risk? We are now driving toward a health system where the patients should share the decision about whether it's a medicine or procedure to go ahead and take the medicine or go through the procedure. So it's really important to be assertive. Now, I'm sure many of you have heard the news about how confusing taking aspirin is. Like, there's been a lot of news reports about taking an aspirin. Well, for many years, until 2005, there was no research on aspirin in women. And then there was a very large research study published, and that research study showed that women between the ages of 45 and 75, if they were healthy, hadn't had a heart attack or stroke, were given aspirin, what would happen? So in fact, they found in that group there was no benefit in taking aspirin for healthy women until maybe they were about 65. And then there was a slight benefit in reducing heart attack risk, and at the same time, an increased risk for bleeding. So we have to balance it. We want people to take the medicines and therapies that will most benefit them. However, they did find something interesting, that in the group there was a small benefit in reducing risk for a first stroke caused by a blood clot. So who should take aspirin? Well, the people who benefit most from taking aspirin are men and women who have established heart disease, and individuals who are 40 to 70 years old without heart disease but at high risk. That means somebody, for instance, who has diabetes and high cholesterol. And if you're in the setting of an acute heart attack, where you have the sudden onset of symptoms, and you heard something about chewing an aspirin, that's a full dose aspirin. But don't wait to see if it works, because aspirin is only one of the things we use in the setting of an acute heart attack. In fact, you need to not only chew on that full dose aspirin, but also call 911 and get to the hospital as soon as possible. And the reason for that is that we do additional things at the hospital when someone's having an acute heart attack. We get an electrocardiogram to confirm whether you're having a heart attack or not. Get blood tests to confirm whether or not you're having a heart attack. And more importantly, do procedures such as a coronary angiogram to take a look at the artery, an x-ray picture of the artery, and if there is a heart attack going on, we open up the artery that's affected so that we save you from heart muscle damage. Because those arteries feed the heart muscle, and if you don't get fast intervention, you can lose the heart muscle function and be at risk for a failing heart. But enough about medicines. Let's look at how far we can get with diet and exercise. So very frequently I'm asked by my patients, what is it that we should eat to prevent heart attacks? And most often people would like a diet that they won't have to stay on. So like it's like something you can do to lose weight. You want to look good at your daughter's wedding in your dress, and then everybody's focused on going on a diet. But really, in order to reduce heart disease risk, you have to have a healthy eating plan. So I know that you all go online and social media, and every day there looks like there's a diet a day. Should it be paleo? Should it be high carb, low carb, keto diet, Mediterranean diet, Weight Watchers, Jenny Craig? What is it that you should choose, or should you just eat wine and chocolate? Because those things have come up as maybe potentially heart healthy. So I just want to just show you a few research studies that are easy to follow. So I always like to look and see if there are gender differences. So does a diet high in carbohydrates increase risk for heart disease? So quartile 1 means low carbs, quartile 4, high carbs. And what you can see is that for the women in the upper bar, for every carb increase in carb eating, they have a higher risk for heart attack. Okay? So you know what, it's kind of like the analogy is, as women, we know that we pay more at the dry cleaners when we get our clothes cleaned compared to men. And we also know we pay more at the hairdresser. So we pay a higher price when we eat a really high carb diet. It doesn't seem to have an effect on men's heart disease risk. But what helps both men and women is following a Mediterranean style diet. So a Mediterranean style diet simply is low in meats and sweets. So it's a whole grain diet. So instead of eating white floured foods, white bread, pasta, it's really like eating whole grains. So quinoa, think quinoa, multigrains, fruits and vegetables. And when I have patients who have a tendency to higher sugar, I point out that not all fruits are equal. For instance, bananas, pineapple, and everything that tastes really sweet and good are actually higher in sugar. So when we talk about fruits, this is about choosing things like berries, apples, omega-3 fats that are in fish. Those are healthy fats, and fish is a healthy low-protein source. Many of you may have read in the past day that they were looking at saturated fat in red meat versus white meat chicken, and the saturated fat is the same. Saturated fat is actually used as the raw material to make cholesterol, so that the more saturated fat you eat, the more your bad cholesterol rises. Instead, we like to recommend that people use monounsaturated fats, such as in olive oil, canola oil, eating nuts like almonds and walnuts. And in terms of wine is something that has been studied, and a lot of the studies were actually supported by the alcohol industry, the liquor industry. So you always have to look at the support. People are worried that pharmaceutical industries sponsor drug studies, but things for lifestyle changes, you should also look at who's sponsoring those. Anyway, in terms of wine, I don't write prescriptions for people to drink wine to protect their hearts, but it's up to 1 4-ounce glass of wine a day. That's considered moderate intake to women because we metabolize alcohol slower, and a higher intake of alcohol can actually raise blood pressure and risk for breast cancer. And in men, it's up to 2 glasses a day. And the Mediterranean diet has really been shown to lower risk for heart disease. So this woman is actually watching an exercise program. She's eating her breakfast and not exercising. But this is a good sign. because we know that all of us go through stages about when we're ready to take care of our health. And so maybe you've adjusted your diet, but she's at least getting information about exercise. Well, exercise is very important, and the more you do, the better you are. So just a simple walk, about at a pace of 3.5 miles, which is probably the typical pace we're walking in New York City, because we're passing people on the sidewalk, can lower your risk by nearly 50%. So taking a half hour a day of walking actually can improve your heart health. But if you want to use exercise as a way to lose weight, you have to increase the duration. And another popular type of exercise is high-intensity interval training. And that, an example would be going the Soul Cycle for a spinning class, because you do high-intensity intervals, then you go down, then you do the weight work. And that actually has been helpful in terms of helping with weight loss. It's also important to do strength training, because you reduce your percentage of body fat with strength training. And there are some studies now that show it may have some strength training as well as aerobic exercise can have some improvements in your cholesterol parameters. But aerobic exercise really is the foundation to improve risk factors. And then frequently I get this, well, you know, Dr. Goldberg, you know, heart disease just runs in my family. I don't think it matters if I exercise, and that's not true. That if you take people, both men and women, who have a family history of heart disease and put them in an exercise program, you actually reduce their risk for having heart disease. Even though there's a strong genetic risk associated with it. And let's talk about stress and how that impacts the heart. For a long time, we've ignored the fact that our brain was connected to the rest of our body. But, you know, stress does take its toll on heart risk factors. It raises blood pressure. It's been shown to raise risk for developing the metabolic syndrome, because your stress hormones lead to increases in belly fat and raise blood pressure. And there are studies that show it increases risk for heart attack. What do you need to do? You need to lower stress, and that's easy to say. So you have to sit down. When I say think rationally, you have to sit down and figure out, what is it that's really stressing you? It's about being assertive. You know, women try to do everything themselves because we all think no one else can do it as well as we do. And you really need to speak up and get some support. For instance, they found that women who have low control over their workplace have a higher risk of heart attack. It's not like you can go in and tell your boss you need more support because they're going to cause you to have a heart attack. You can't say that. But it's really about learning how to delegate and finding a way to relax. I think that yoga, using apps that help with relaxed breathing, help people to cool down, and it also is a big adjunct in lowering blood pressure. Making sleep a priority. So sleeping less than 7 hours a night seems to raise blood pressure and belly fat and risk for heart disease. So if you're not sleeping well, try to figure out why that is. Maybe you need a sleep evaluation. Exercise. Exercise is a great foundation. It raises good cholesterol, lowers bad cholesterol, helps you keep your weight down, and improves your blood sugar. So it's a great foundation. And laughing. Laughing relaxes your blood vessels. And anytime you can relax your blood vessels, you actually make them more resistant to developing cholesterol. But something else that's very important to all of us is maintaining our memory. And I just thought I would share the role of exercise and eating a Mediterranean diet lowers risk for the development of, to help maintain the connections for memory. And what about supplements and vitamins? Do they really help? Well, coenzyme Q10 does not reduce risk for heart disease. Sometimes we prescribe coenzyme Q10, although there's very limited research right now, to help prevent muscle aches that people experience on statins. Omega-3 fish oil. We use fish oil to actually lower triglyceride levels when they're elevated. And there's a new fish oil product that's prescription that actually shows that it reduces heart disease risk. So that individuals who are going to need to be prescribed fish oil will probably be prescribed that medication. Chocolate has antioxidants, and antioxidants help maintain flexibility of your arteries. But lots of things have antioxidants, like blueberries, pomegranate. So you don't necessarily have to eat very dark chocolate. And if you eat too much dark chocolate, and this is a story that really happened in practice, one of my patients came in with symptoms of palpitations. And I was sitting there asking her all these questions. Are you drinking too much coffee? Are you stressed? Are you not sleeping? And then she said, oh, I just got this really good dark chocolate. Somebody brought it as a gift, and I've been eating it because chocolate has caffeine. And so you could actually get over-caffeinated if you eat a lot. Calcium supplements. So calcium is very important. Calcium is very important for bone strength. And there have been studies that indicate taking calcium supplements may increase risk for heart attacks. And although the jury is still out on that, what we do recommend is the average woman needs about 1,200 milligrams of calcium a day, is to balance it with supplement and food. Soy is a good low-fat protein alternative. But you know, if you think you're going to lower your cholesterol with soy, you know, 150 grams of soy a day is a lot of soy to lower your cholesterol. And some breast specialists really advocate against eating a lot of soy because it can raise hormone levels. Red yeast rice is a supplement that's similar to statins, can lower cholesterol. It's important that you share that information with your doctor since you shouldn't take that supplement with cholesterol-lowering medicine, and it can cause side effects. But in the end, I want to say that I hope all of you... this is a funny slide because last August there was a study published that actually showed that men and women who went to the emergency room that were treated with a woman doctor were more accurately treated, more accurately diagnosed with their heart attack symptoms. And I did this. I think the taking care of heart disease in women should be shared by both male and female physicians. And that I also want to tell you that in order to do your good work in keeping the hospital healthy and do great things for a hospital, that it's very important for you to take care of your hearts. Thank you.